Hi, my name is Taiga Nishihori. I'm from Moffitt Cancer Center in Tampa, Florida. Today I'm talking about the results of BMT-CTN 1302. This is a multi-center phase 2 study of ixazomib maintenance after allogeneic transplantation in multiple myeloma. The myeloma, as you know, is a disease that has high mortality risk, and especially for high-risk population, treatment modality is limited. And we attempted to ask the question of whether proteasome inhibitor would improve the outcome of allogeneic transplantation in high-risk myeloma. So we attempted to enroll patients with high-risk disease and condition them with fludarabine, melphalan, bortezomib, and randomized patients after 60 to 120 days to either ixazomib or placebo, and attempted to treat with 12 cycles of therapy. And the intended randomized sample was 110. And unfortunately, the study was temporarily put on hold due to mortality and press, and they removed bortezomib after transplant. We have reopened the study and enrolled additional patients. And then the study was prematurely closed, and the result, what we saw was that the PFS and OS, as well as the GVHD rates, were similar between the group. And ixazomib maintenance was completed in majority of patients who are on ixazomib. However, for unknown reasons, placebo patients had less number of completed cycles. In the end, we concluded that we could not particularly answer the question of ixazomib maintenance and allogeneic transplantation. However, overall, the study showed that survival and progression-free survival was quite reasonable for this high-risk population, and allogeneic transplantation certainly remains an open question for high-risk myeloma patients. In the context of evolving and expanding cellular immunotherapy, I think the place for allogeneic transplantation remains to be seen. And there are questions that are being asked whether allogeneic transplantation could be done either before or after CAR-T, and what would be the population that we would try this modality. So I think in the end, we still have an allogeneic transplantation as an option. However, I would believe that this question should be asked in a well-designed controlled trial.